Dr. Wallensky, it's been reported by some virologists and scientists that this year around 170 people have died from taking the regular flu vaccine. The Vaccine Advisory Adverse Reporting System reported that the number of people dying after or following the COVID vaccine is actually in the thousands. Now, this is what I'm hearing. I'll give you a chance to refute that or confirm it here. You know, is this true? Are we having that many people die after taking one of these vaccines?
Senator Tuberville, thank you for that question. The Vaccine Adverse Event Reporting System is a mandatory system of any adverse event that happens after being vaccinated. So if you get hit by a car, tragically, after getting vaccinated, that gets reported in the Vaccine Adverse Reporting System, the VAERS system. So the vaccines are incredibly safe. They protect us against Omicron. They protect us against Delta. They protect us against COVID. They don't protect us against every other form of mortality out there.
Do we keep numbers of people that died following taking a COVID test from taking this vaccine? Do we have any idea? I'm just asking.
I'm sorry, those who have died after taking a COVID test?
Died following taking the vaccine. Is there any number count? Do we keep records on that died of just from?
Absolutely, yes. I couldn't give you the absolute number off the top of my head, but our staff could absolutely get back in touch with you. We collect those data.
You know, Dr. Fauci, you have any clue on that?
About how many died after?
100?
I don't know the number, but I think it's really important for people.
You can turn on your
Microphone.
I'm sorry. I don't have a number, but I think part of the confusion is that when you do a reporting, if you get vaccinated and you walk out and get hit by a car, that is considered a death. I mean, that's the thing that gets confusing, that everything that happens after the vaccination, even if you die of something completely obviously unrelated, it's considered a death. So if I had metastatic cancer, got vaccinated, and died 2 weeks later, that's a death that gets counted.
I understand that. Yep.
And every one of those is adjudicated.
Okay, thank you. Dr. Wallensky, I don't know if anybody's asked this question. I just want to get cleared up. Our Supreme Court Justice last week, looking into the situation with the mandate, Justice Omar said there's 100,000 children that are sick as we speak with Omicron, and a lot of them are serious in hospital. Is that true or false?
I don't have the number of children in the hospital right now. It's likely less than 100,000.
Yeah. And Justice Breyer said that, you know, that if we continue to delay this ruling, that we're going to have 750,000 more that are not vaccinated infected a day. I mean, does that make sense to you?
What I can tell you is our children between the ages of 0 and 4 are one of the only places where our hospitalization rates are currently rising, and that children who are in the hospital are generally unvaccinated, not uniformly, but generally unvaccinated. And that's true for not just our 0 to 4 who are obviously ineligible, but also true for our 5 to 11-year-olds as well as our 12 to 17-year-olds.
Thank you.
The list goes on. Well, what's making the situation worse are the officials leading our nation's COVID response going on national television and contradicting each other. And of course, some Supreme Court justices are spreading misinformation as well. Dr. Wallensky, this past week, you recommended asymptomatic people be able to return to work after 5 days. But Dr. Fauci ambiguously corrected you on national television and suggested folks needed a test before return. How does it make you feel when Dr. Fauci or someone like Justice Sotomayor upstages a previous statement or policies of yours, blatantly contradicts and undermines your guidance, or offers false claims that cause more confusion for the American people?
Thank you, Senator. I have the great honor of leading the agency of 12,000 public health servants in this country, and we work collaboratively with tens of thousands of public health officials around the country to provide guidance. I also get to work with a COVID-19 task force that is full of a multidisciplinary group of people with diverse expertise, from immunology to drug regulation to epidemiology. This science is moving really quickly, and I know you will appreciate that it's moving fast and it is changing, and it is
Right,
our
but you're not answering my
responsibility to
question,
convey that
So
science.
I'll move on.